Malaria, a disease normally found in the tropics, but it is spreading fast as a result of global warming and could soon be endemic in the UK. The British Medical Association said the predicted higher temperatures and heavier rainfall caused by rising emissions of greenhouse gases will boost the burden of disease and exacerbate health inequalities.
Climate change at the moment has had relatively little impact on health, but for the future, if it continues to get worse, it could be significant. For example, diseases which we currently think of as tropical diseases could become endemic to the UK, for example, malaria. And that will mean that doctors see a different pattern of health and illness and have to be trained to deal with that. In addition to that, of course, climate change and the impact it could have on, say, flooding or drought could make a significant difference as well.
Malaria is spread by the female Anopheles mosquito and causes widespread death in Africa and Asia. The Anopheles is already present in a very limited part of the UK, but could quickly be spread throughout the country as the weather gets hotter and wetter.
The worst forms of malaria in particular around the world kill millions of children. So we would have to give a lot of intensive treatment. We might have to think about things like sleeping with netting over the beds in certain areas of Britain, or of course the alternative to attack the environment in which the mosquitoes live using very powerful pesticides.
There are other health implications too. The report warned that severe floods, like those seen last summer, could become more frequent, along with heat waves and other extreme conditions. It predicts a major heat wave is likely in the UK before 2012, leading to as many as 10,000 deaths. Hospitals need to prepare for increased cases of skin cancer, asthma and diseases spread by parasites and contaminated water.
They can make sure that the people they work for, the NHS, looks at the best practice in terms of building hospitals and clinics and so on to make them as carbon neutral as possible and absolutely as energy efficient as possible. We should also be contributing to what are the alternatives to some of the packaging and the use of plastics that we have in the health service, which don't risk patients but do help to protect from climate change. And then we all, because there are 1 million people working in the health service, as individuals, as citizens, can do the things as individuals to reduce our own carbon footprint. And beyond that, we can actually help to educate people so that when we have to deal with the changes that we're already seeing and the changes that may now be inevitable, that we're all best able to do that.
Doctors can help educate, but the public will play a vital role in reducing greenhouse gases by changing their lifestyles.
The scientific consensus is that there is likely to be climate change, that we're already seeing some elements of it. How significant the final impacts of this will be depends upon whether we all, as individuals, as citizens, and as the UK and as other countries, are able to change the way in which we use energy and disposables and reuse things and so on. If we do all of that and we all take effective action, then we may be able to halt climate change, which is good news for everyone.
With extreme weather events now affecting all regions of the world, the BMA believe there needs to be international action to warn the public of the dangers it poses to human health.